Hello, my name is Mollie Cartwright. I'm a gynecologist in Louisville, Kentucky. I graduated from the University of Louisville Medical School and did my residency training at the University Hospital in Louisville, Kentucky. I've been in practice since 1989. I've been married for 32 years and have 3 children. My goal in taking care of women is to improve their health by empowering them with information to lead healthier lives. I had a hysterectomy 1 week ago. I seem to cry about everything. What is wrong with me? It is very normal to have emotional moments following a hysterectomy due to an interruption of your normal sleep cycles and routines. You have been through a lot and your body is fatigued. The stress of surgery alters our hormone production even if the ovaries were not removed. Many women fail to realize that hysterectomy is a major surgery, whether an open incision or the laparoscopic minimally invasive approach. Taking time to rest will help your body to recover from this stressful event. I'm dealing with feelings of loss over my womb. Is this normal? Yes, that is very normal. What you're describing is quite common. This is true whether a woman has not been able to conceive after years of infertility or for a woman who chose not to ever have children. It's also true for women who have decided they've completed their families. The loss of the uterus is a very personal loss, sometimes tied to the very core of our feelings as a woman. Most often, your feelings of grief over the loss of your womb last only a short time. If you find your grief is lasting longer than a few weeks or is disrupting your life, be sure to talk to your doctor about your concerns. Now that my uterus was removed, I feel less of a woman. Is this normal? Our femininity is not based in a single organ such as our uterus or our ovaries. The uterus is a wonderful, amazing organ, but is a singular portion of what makes a woman a woman. And when it is missing, there is so much more than that makes us feminine. Our greatest assets are not found in the separate parts of our body that we retain, but in our caring arms, our giving hearts, and our brain, which is the largest sexual organ a woman possesses. Let me remind you that with or without a uterus, you can demonstrate strength, beauty, and wisdom, which are all traits of femininity. Physically, I feel good, but I'm feeling so sad. What's wrong with me? The loss of ability to conceive is difficult for many women because it closes a chapter of life. Look for ways to get back to your hobbies that you enjoy and visit with your friends. If you find that you're having more sad days than normal, and you discover that you no longer find joy and happiness in the things you once did, I encourage you to make an appointment with your healthcare provider or your family doctor to discuss your concerns and the possibility that you could be suffering from depression. What are the symptoms of depression? What treatment is available? If you suffer from a lack of appetite, fatigue, anxiety, feelings of isolation, these are all signs of depression. And it is not uncommon for a woman to feel bluesy or sad for a short period of time following surgery. Sometimes a good support system is all a woman needs to get past these feelings of sadness or depression, but if feelings of hopelessness or despair arise and last longer than a day or two, then it is time to make an appointment with your doctor. Medication may be necessary for you to begin to feel better overall. The goal is for you to feel better and more hopeful for your future.